Have you ever wondered how to identify the early signs of autism in children? This video is an opportunity for you to learn about 12 important symptoms of autism spectrum disorder, ASD, in children from the age of 2, and understand why it's important to watch until the end. This information could transform how you understand and support children on the spectrum. I'm a parent of 2 boys with ASD and have learned a lot through daily interactions. Today, I'm sharing not just technical knowledge, but also my experience as a parent. Autism is not a limitation, but a unique way of experiencing the world. Recognizing the signs early is essential to providing the proper support. Throughout this video, you'll learn about social, emotional, sensory behaviors, and much more. These signs are like puzzle pieces that, when put together, may indicate the presence of autism. So stay with me until the end and discover how to better understand these incredible children. Autism, or autism spectrum disorder, ASD, is a neurological condition that affects millions of people worldwide. It is not a disease, but a unique way the brain functions, influencing how a person perceives and interacts with their environment. One of the greatest challenges in diagnosing autism is that it does not manifest in the same way in every child. Some may show very clear signs, while others have more subtle characteristics. The autistic spectrum is precisely that, a spectrum with varying levels of characteristics and behaviors. Common signs that may appear in children. From the age of 2, difficulty maintaining eye contact. Many autistic children prefer to avoid direct eye contact, not because they do not want to connect, but because it may be uncomfortable or even overwhelming for them. Preference for playing alone. It's common for an autistic child to prefer playing alone rather than engaging in group activities. This doesn't mean they dislike other people, but that they may have difficulty initiating or maintaining social interactions. Restricted and repetitive interests. Some children intensely focus on a specific theme or activity, such as lining up toys or memorizing brand names. This focus can provide comfort in something predictable and controlled. These signs, when isolated, do not necessarily mean that a child is on the autism spectrum. However, when a combination of these behaviors is observed, it's important to seek a professional evaluation. When to seek help. If you notice several of these signs, even if they are mild, it is essential to consult a specialist. A pediatric neurologist, child psychologist, or speech therapist can help evaluate the child's behavior and, if necessary, suggest appropriate interventions. Early diagnosis makes a significant difference, allowing the child to develop their skills more effectively. Remember that autism is not a problem to be solved, but a characteristic that requires understanding and support. Every child on the spectrum is unique and has much to offer the world. Recognizing this is the first step toward a more empathetic and enriching relationship. Social and emotional behavior. Now let's delve into symptoms related to social and emotional behavior. These are some of the most noticeable signs in autistic children, and are often the first to raise concerns among parents and caregivers. Avoiding eye contact. It's common for children on the autism spectrum to avoid looking directly into people's eyes during conversations. Eye contact can be uncomfortable or even overwhelming for them. They may focus on other details, such as the person's lips or hand movements instead. Difficulty forming social bonds. Autistic children may find it hard to make friends or engage in group play. They might prefer playing alone or using toys in unconventional ways, such as lining up blocks, rather than building something with them. This difficulty in connecting does not mean they dislike company, but that they struggle to understand social rules. Lack of understanding of emotions. Identifying emotions in others' facial expressions can be challenging for autistic children. For example, they may not recognize when someone is sad, angry, or happy. This can lead to reactions that seem inappropriate, such as laughing during sad moments or not responding when someone shows affection. Unexpected emotional responses. Children on the spectrum may react in ways that seem out of context to others. For instance, they might laugh during a sad scene in a movie or show no enthusiasm at a birthday party, even if they feel happy inside. How can parents help? Helping an autistic child understand and express emotions is a challenge, but it's also an opportunity to strengthen family bonds. Some tips include naming emotions. Whenever possible, explain what's happening emotionally. For example, you're frustrated because the toy didn't fit together correctly. Using emotional cards or images. Show pictures of faces with different expressions, happiness, sadness, anger, to help the child identify and name emotions. Practicing patience and empathy. It's important to remember that autistic children don't ignore others' feelings on purpose. They simply process this information differently. Developing social skills. Encouraging social interactions can be challenging, but small steps make a difference. Activities involving just one other child can be a good starting point. Additionally, parent-guided play that teaches social rules in a practical way helps the child feel more comfortable in future interactions. Overcoming prejudices. One of the biggest challenges families of autistic children face is prejudice and a lack of understanding. Behaviors such as avoiding eye contact or social isolation are often misinterpreted as disinterest or extreme shyness. Understanding that this is part of the autism spectrum helps avoid judgments and enables appropriate support. Children on the spectrum have much to teach about empathy, patience, and acceptance. By understanding the social and emotional difficulties they face, we can help them build stronger and more effective connections. Rigidity in routines, hyperfocus, and sensory sensitivity. These aspects, while they may seem challenging at first, reveal much about how autistic children process the world around them. Rigidity in routines. Autistic children often have a strong need to follow established routines. This rigidity provides them with a sense of security and predictability. Unexpected changes, such as altering the route to school or changing the time of a meal, can cause significant discomfort and even emotional crises. For instance, if a child is used to bathing before dinner, changing this sequence might lead to resistance. How to manage it? Give advance notice. Explain any changes simply and clearly beforehand. Create alternatives. If the routine needs to change, present a new sequence that is also predictable for the child. Hyperfocus. Hyperfocus is the ability to concentrate intensely on a specific topic or activity. Some autistic children show deep interest in themes like numbers, dinosaurs, cars, or even a single toy. While this interest can be a learning opportunity, it may also make it difficult to transition to other activities. How to encourage it? Leverage interests. Use the child's favorite topic as a starting point to teach other skills. Balance focus. Gradually encourage activities outside their favorite subject to help them expand their world of interests. Sensory sensitivity. Many autistic children have heightened sensory sensitivity. Loud sounds, flashing lights, certain clothing textures, or even smells can be intensely uncomfortable for them. Environments like crowded shopping malls filled with noises and visual stimuli can be extremely stressful. How to identify it? Sensory crises might include covering their ears, crying, isolating themselves, or even screaming. Behaviors like avoiding certain fabrics or rejecting specific foods might also be linked to sensory sensitivity. How to help? Reduce stimuli. Use noise-canceling headphones, comfortable clothing, and avoid highly stimulating places whenever possible. Teach coping strategies. Explain how the child can handle uncomfortable stimuli, such as stepping away from loud noises or asking for help. Let me know if you'd like me to proceed with the final sections. Turning challenges into opportunities, rigidity, hyperfocus, and sensory sensitivity may seem like barriers, but with patience and understanding, they can be transformed into tools for the child's development. For example, hyperfocus can lead to incredible talents in specific areas, while sensory sensitivity can teach parents how to create calmer and more welcoming environments. Demystifying behaviors. It's important to remember that behaviors like sensory crises or insistence on routines are not tantrums or whims. They reflect how an autistic child perceives and responds to the world. Accepting and supporting this perspective makes all the difference in helping them feel safe and valued. Speech difficulties, repetitive movements, and other important signs. Now we've reached the final part of the video, where we'll discuss communication difficulties, repetitive movements, and other signs that are also important for identifying childhood autism. These behaviors, although often subtle, provide valuable clues about the unique way autistic children interact with the world. Speech delays or difficulties. Not all autistic children experience speech delays, but many have difficulty using language functionally. Some may take longer to start speaking, while others may use words differently, such as repeating phrases or referring to themselves in the third person. Anna wants water instead of I want water. Additionally, some children create their own language by mixing sounds and words, which can be difficult to understand. This can be frustrating for parents, but it's important to remember that these difficulties are part of the child's development on the spectrum. How to help. Work with a speech therapist. This professional is essential in helping the child develop communication skills. Use alternative communication tools. Visual aids, like pictures or apps, can help complement verbal communication. Language regression. In some cases, children who have begun speaking may suddenly stop or lose part of the linguistic abilities they had acquired. This is known as regression and can be one of the first signs of autism that worries parents. While regression can be alarming, with early intervention, many children can recover or even surpass these abilities. Repetitive movements, stereotypies. Autistic children often exhibit repetitive movements, known as stereotypies. These can include rocking, hand flapping, spinning objects, or walking on tiptoes. These behaviors often serve as a way for the child to cope with stress or process sensory stimuli. How to manage it? Accept the movements. They are a form of self-regulation and are usually not harmful. Redirect carefully. If the movement is dangerous or excessive, offer an alternative, such as squeezing a toy or performing another safe repetitive action. Putting objects in the mouth. Although common in babies, continuing to put objects in their mouth after age 2 may be a sign of autism. This is related to seeking sensory stimuli. Some children have a greater need to explore textures and sensations with their mouths, which may include biting or chewing on objects. How to help? Provide safe alternatives. Specialized teethers for older children can be a good solution. Supervise the behavior. Ensure that objects placed in the child's mouth do not pose risks. Difficulty completing tasks. Autistic children may struggle to move from one activity to another. They can become so focused on a task that they feel frustrated or anxious when they need to stop. How to help? Create clear routines. Use visual boards or schedules to indicate the start and end of each activity. Give warnings. Let the child know in advance that the activity is about to end, giving them time to prepare. Other important signs. In addition to these behaviors, other signs may indicate autism, such as walking on tiptoes, not responding to their own name, or showing a preference for organizing objects in specific ways, such as grouping them by color or shape. Why is it important to seek help? Early diagnosis is crucial to ensure the child receives appropriate support. Interventions such as occupational therapy, speech therapy, and psychological counseling can help develop social, emotional, and communication skills. These were the 12 signs of childhood autism we discussed today. Remember, every autistic child is unique, and these signs can vary in intensity. If you notice several of these behaviors in a child, the best course of action is to consult a specialist. Early diagnosis and proper support can transform the child's life and that of their family. If you enjoyed this video, don't forget to leave a like, subscribe to the channel, and share this content with others. Your participation helps spread knowledge and create a support network for families living with autism. See you in the next video.